So today we will discuss about Vranitagara. What is the word meaning of Vranitagara? Runa means agara, gara. You can say, have you heard about the post-op ward or recovery room? So Runita, either he may be a traumatized person or else a post-operative patient who is kept for recovery. So there is a special arrangements are told by SUSRUTA for wounded person or post-operative patient. Okay. So we are going to look into what is Vranitagara. See, the patients with wound require a special ward which is aseptic. What is the word meaning of aseptic? See, the atmosphere from which the getting infected will become reduced. Okay. So that is aseptic measures. Comfortable where all the emergency materials are available. Ronitasya pratamameva agaram ichyate tachagaram prashasta. So that agara, how it should be? It should be prashasta and according to vastu. The person with wound requires separate ward which is constructed in prashasta vastu. What is the word meaning of prashasta? Okay, prashasta means what? Equipped with everything. Prashasta area. So we will see one here. Prashasta means prashastatvam hi marmadi rahitatvam. It should be free from the marma. Marma means what? Something vital, some which is delicate, something like that. Area one which is free from the any kind of weak structures or surfaces. So what is the word meaning of prashasta? Prashastvam marmadi rahitatvam. There should not be any marma, there should not be any weak point in that area. So that kind of area is called as prashasta. What is the vastu? Vastu shabdena deshaha. Vastu means area. So in the prashasta area it has to be constructed. Which one? Which one? Vranitagara. What is the importance of Vranitagara? If the Vranitagara is constructed in a prashasta bhumi, prashasta vastu, what happens? Prashasta vastu hi grihe, so okay, sharira agantuja manasa. The person who reside in the Vranitagara, he will be free from, or when he reside in the prashasta vastu area, then he will become free from sharirika, agantuja and manasa rogas. Okay. A physical, mental and traumatic wound can be prevented living in a ward which is clean, devoid of direct sunlight, breeze and should be constructed in the prashasta vastu. This is the importance of Vranitagara. See, sharirika, how this Vranitagara can prevent sharirika rogas? How it can prevent traumatic wounds, agantuja ronas? How it can prevent mansika rogas? Anybody? See, let me know one thing, whether atmosphere plays any role or the seasons, change in the seasons or rutus play any role on our health or not? Yes. How you can say that? Season, rainy season, okay. So this is a season for the showing and all. In the farms and all they do the showing, no? So if it becomes 15 days late also, the means there will be a difference in the yielding of the crops. Is it or not? अभी क्या वो मतलब शोइंग करते हैं अभी यहाँ इस एरिया में? हाँ, ग्राउंड नट्स. सो ग्राउंड नट्स को हम एक मंथ होने के बाद शोइंग किए तो सेम यील्ड आएगा? क्यों? Because season will affect on the life. मैंगो समर में ही आएगा ना? Why it is so? Mango tree knows when which season comes and all. It means there is a special effect of seasons on the life. Is it or not? So, it brings some certain modification. So, light, wind and the atmospheric changes like temperature and all, that is going to affect on the health. Life में health काम कर रहा है तो फिर health में ही काम कर रहा है ना. Are you agree that the season will affect on the health? Yes, sir. So, what is the atmosphere then? Atmosphere में क्या change होता है? Temperature change होता है, wind का flowing direction change होता है, then the sunlight will differs and the intensity of sunlight will differ, and appearance and disappearance of the rain. Okay, these are the changes which appears in the as the season changes. Apart from this, anything else changes? Temperature हो गया, wind का flow हो गया, then sunlight हो गए. इसके छोड़ के और कुछ डिफरेंस होता है सीजन चेंज होने से? मतलब these are the things which affect on the health. So, these things has to be considered when you are building the house, when you are building a hospital and when you are building a Vranitagara. Has he told anything wrong in this? See, one which affect the life, it indirectly is saying that it affect your health. So, it can prevent the physical diseases. Are you agree? The one which is built in Prashasta Vastu can bring you health and it can bring the disease also. Are you agreed or not? Okay. What about the mental health then? Okay, assume if you are sitting in such a room for studying, if you are sitting in such a room where all the articles are not neatly arranged, you forget about the light, wind and all those things, and just assume where the things are very neatly arranged, well decorated and it is very peaceful. So, in which atmosphere you would like to read? Is it no? Means the atmosphere will affect on your peacefulness. Means peace is related to body or mind? Okay. So, the surrounding things will affect on the mind or not? Okay. Hence, it will help us to maintain the health of the mind also. Prashasta Vastu. What about the Agantuja? What are the Agantuja runas? Abhigataja, then Vishas, then if the Vranitagara is constructed in Prashasta Vastu, you can prevent the insect coming insect or worms enter into your area. Because what is the word meaning of Prashasta? What is the word meaning of Prashasta? Marmadi Rahitatvam. Okay. This is the importance of Vranitagara. Why we require the Vranitagara? How it has to be constructed? How the infrastructure of the Vranitagara has to be? The bed, how it has to be? Swastirna, it's adequate. Manodnya, it's a pleasant. Praksh Siraskaha, should be lie down facing the east. How it should be? Shayana Sambandhaha Savistirnaha Manodnyaha Prakstiraskaha Shastra Kurvitaha. How it should be? It should be adequate. Bed should be adequate, should be pleasant and facing the east, and there should be some weapons placed towards the head end of the bed. Adequacy, Manodnyaha, we can understand. What about he should face the east? So, in the next shloka only he says, so if you are person facing the east, so he can solicitate the east directionated god. So, it will become easier for him. So, that is why the patient should be lie down facing the east. Who is the god resides in east? Ishanya. If it is Shiva in east, then Ishanya. Ishanya means northeast. Then who is residing in the east? Agneya, Agnideva. Nairutya, Paschima. Note down, homework. Okay, let me know in the next class. See, he says before shifting the patient into the Vranitagara, you have to fumigate it. You have to do the dhupana karma with using sarshapa, okay, and then arishtapatra. Arishtapatra means leaves of the nimba, ajadirakta indica, and sarpi and lavana. So, are used to fumigate the ward twice in a day for 10 consecutive days. Once you do the proper dhupana, then afterwards only you can shift the patient into Vranitagara. So, different dhupana dravyas are told based on the different diseases. Like Rona, if you are shifting the patient for if he is a Vranita, then there are different dhupana dravyas are told. For Jara patient, there are different dhupana. Unmada, there is a different dhupana dravyas are told. Okay, any doubts here? Sarshapa Arishtapatrabhyam Sarpisha Lavanena Cha. What are those drugs? Sarshapa Arishtapatrabhyam Sarpisha Lavanena Cha. See, Dallana says, what is dhupana? Importance of dhupana. Makshika Adi. Makshika means what? Flies and all. Rakshasha. So, it does the Rakshana from Makshika Adi and Rakshasa. What is the word meaning of Rakshasa? See, if dhupana, if you do the proper fumigation, the flies won't enter. So, flies are not entering means, flies and other insect, if they are not entering means, you are avoiding the wound getting infected by the exogenous things. Okay. What about the Rakshasa then? Who is a Rakshasa? Bacteria. What is the word meaning of Rakshasa? Okay. Rakshana. Rakshana means one which protect. The word Rakshasa is derived from Raksas, which means which harms. So, you might have studied Balagraha. What are the causes for Graha doshas? First one is Himsa. Means if any wound is there, that is the route of entry for Graha, the Rakshasa to enter into the body. Second one is Rati, say sexual transmitted diseases. Okay. And third one is, what is the third one? Note down. Homework. See, Balagraha, he has told the causes for this. Okay. So, this is about the Vranitagara. If you have any doubts, you can ask.